Bipolar disorder reduce mental health awareness. An individual's mood, energy level, and capacity for function can change as a result of bipolar disorder. Bipolar disorder reduce mental health. Bipolar disorder patients go through intense emotional states known as mood episodes, which typically happen over discrete intervals of days to weeks. Manic/hypomanic, an abnormally happy or irritable mood, or depressive are the two classifications for these mood episodes. Sad mood. Most bipolar patients also experience periods of neutral mood. Bipolar disorder sufferers can live full and productive lives if given the right treatment. 80 to 90% of people with bipolar disorder have a family member who also has the condition or is depressed. Bipolar disorder reduce mental health. Stress, irregular sleep patterns, drugs, and alcohol can all cause mood swings in people who are already vulnerable. Although the exact brain-based causes of bipolar disorder are unknown, dysregulated brain activity is thought to be caused by a chemical imbalance. A manic episode triggers the diagnosis of bipolar I disorder. People who have bipolar I disorder go through extreme energy spikes and may feel as though they are on top of the world or are uncomfortable irritable during a manic episode. Most individuals with bipolar I disorder also go through periods of neutral mood, and some individuals with bipolar I disorder also go through depressive or hypomanic episodes. Symptoms of bipolar I disorder. A manic episode is a period of at least 1 week during which a person exhibits at least 3 of the following behavioral changes and is excessively elated or irritable for the majority of the day on most days. Larger or more rapid speech. A person experiencing manic episode symptoms frequently needs hospital care to remain safe. A hypomanic episode is characterized by milder versions of manic symptoms, which need only last 4 days straight as opposed to a full week. Hypomanic symptoms do not frequently result in the serious disruptions to daily functioning that manic symptoms do. Bipolar disorder reduce mental health, so please aware from this. Major depressive episode. A major depressive episode is defined as a period of time during which a person experiences at least 5 of the symptoms described below, including at least one of the first 2 symptoms. Bipolar disorder reduce mental health, for at least 2 weeks. Pacing or agitation, or slowed speech or movement. With treatment, bipolar disorder symptoms frequently get better. The mainstay of bipolar disorder treatment is medication, but talk therapy, psychotherapy, can help many patients understand their condition and take their medications as prescribed, reducing the likelihood of future mood swings. The most frequently prescribed class of drugs for bipolar disorder is referred to as mood stabilizers and includes drugs like lithium. Continuous preventive treatment is advised because bipolar disorder is a chronic illness and bipolar disorder reduce mental health with mood episodes that frequently recur. Treatment for bipolar disorder is individualized, and patients may need to try a variety of drugs before settling on one that is most effective for them. A person must experience at least 1 major depressive episode and 1 hypomanic episode to be diagnosed with bipolar II disorder, see above. When there are no new episodes, people resume their regular activities. Since hypomanic episodes frequently feel enjoyable and can even improve performance at work or school, people with bipolar II disorder frequently seek treatment after their first depressive episode. Anxiety disorders and substance use disorders are common in people with bipolar II disorder, and the latter can make symptoms of depression or hypomania worse. Depending on the specific symptoms, mood stabilizers and antidepressants are the most frequently prescribed drugs. A milder version of bipolar disorder called cyclothymic disorder involves a lot of mood swings, with frequent episodes of hypomania and depressive symptoms. Cyclothymia patients experience emotional ups and downs, but with milder signs and symptoms than those of bipolar I or II disorder. Symptoms of cyclothymic disorder include the following. Numerous periods of hypomania and depression have been present for at least 2 years, but the symptoms do not fit the description of a hypomanic or depressive episode. The symptoms, mood swings, have been present for at least half of the 2 years and have never subsided for longer than 2 months. Medication and talk therapy are 2 possible forms of treatment for cyclothymic disorder. Bipolar disorder reduce mental health. Talk therapy can often relieve the stresses brought on by mood swings. Why is mental health important? Stabilizing constructive behaviors, emotions, and thoughts requires maintaining good mental health and treating any mental health conditions. Focusing on mental health care can boost productivity, improve our self-perception, and strengthen bonds with others. Taking care of our mental health not only makes it easier for us. Taking care of our mental health can also have the following advantages. Know that there is assistance available if you or someone you care about requires mental health care. A mental health condition, the higher the likelihood that treatment will be effective.